Hi, good morning fellow future pharmacists. Communication plays a very important role in the retail pharmacy setting. Various challenges present itself in this setting. Therefore, today we will be watching and evaluating a scene that may occur during your practice. Here is Mrs. Tang and her son.
Hi Mrs. Tang, long time no see, how are you?
Hi Daphne, I didn't know you're on duty today. You're looking very healthy.
Yeah, I'm on duty today. Oh, you brought in your son?
Yeah, this is Adrian, my 5-year-old son. Adrian, say hi to Daphne Jeje. Hi Jeje.
Hi.
Can I get something for his cough, please?
Cough or chiclet is a natural process and a protective reflex in healthy individual. The main function of cough is airway clearance, where foreign substances are ejected through the combination of coughing and the movement of cilia hair. It is the most common respiratory syndrome as it is found in many diseases. They are generally described as productive or non-productive, or in layman terms, wet or dry. Excessive coughing, however, may indicate an underlying disease or disorder. One of the many ways as pharmacists can differentiate a type of cough is by listening. Here are a few sound samples of cough. The sound of this cough is more dry. This kind of cough may occur as a result of a recent viral infection, flu or cold. This is the reason why dry cough is sometimes referred to as post-viral cough. One of the other few diseases that produces dry cough are asthma, influenza, tuberculosis, pneumonia, or sometimes irritants. There are also a few kinds of unique dry coughs, such as this is known as whooping cough or pertussis. It is a contagious bacterial infection of the lungs. The patient gasping for air in between the bouts of coughs causes a whooping sound, hence the name whooping cough. This is known as a barking cough. It sounds like a dog barking or a seal barking. This is an indication of a virus-caused disease called croup. Croup, C-R-O-U-P. It is the inflammation of the larynx and the trachea. Most at risk of getting croup are children between 6 months and 3 years of age. Most cases are not severe and will go away on its own. This is a productive cough. The sound of the cough is more phlegmy and chesty. It can be caused by pneumonia, postnasal drip, chest infections, etc. Now let's get back into the scenario. It is always best to determine if the patient is free to talk. From there, we can determine the amount of time to allocate.
Mrs. Tang, are you free now? I might need more time to explain the condition to you.
Yes, I'm free, dear.
So may I know how long has it been since he had this cough?
It happened 2 days ago, and I just want something to ease his cough.
That sounds like a dry cough.
Here we go back. This is the moment. Tonight is the night. We fight till it's over. So we put our hands up like the ceiling can.
Mrs. Tang, can I speak to Adrian for a while?
Sure.
Adrian, do you feel pain or irritated when you cough?
Yeah,
Do you get lots of cough at night?
I cannot sleep.
So how do you feel when you drink?
It's painful.
No worry, Adrian. Khee will give you something to help you recover.
Communicating with children is not a difficult task. Make sure to bend your body and have eye contact with them. Try communicating in a soft tone and use simple sentences so they understand you. The most important thing is to make them feel comfortable when talking to you. And please show your empathy. Last but not least, smile and nod to them when speaking.
So is there any other symptoms that he is experiencing?
No, I don't think so. He just complains that it's irritating and that he can't sleep well.
Can you tell me what Adrian has been up to lately?
He just goes to kindergarten as usual, but then recently he has been quite active in kindergarten activities. So he's outdoors most of the time.
So, excuse me, do you have medication for rashes?
Sir, can you have a seat first? I will assist you later.
Oh,
So do you notice any phlegm when he coughs?
No, this cough is not the same type of cough like he had last 2 weeks ago when he had upper respiratory tract infection. I was relieved that he got better from the infection, but then 2 days ago he started having the cough again.
As a pharmacist, we should always consider all the factors that might cause a patient's illness. Therefore, based on the information given by Mrs. Tang, there are few possibilities that could have triggered the dry cough. Since Adrian had an upper respiratory tract infection recently, it could be a post-viral cough. One possible cause for post-viral cough is that the receptors that are responsible for stimulating the cough during the inflammation are upregulated by respiratory tract infection and continue to stimulate even the symptoms have gone. Other than that, being active outdoors, the cause of the cough could be because of exposure to polluted environment such as haze, cigarette smoke, or temperature change. However, if the cough is due to pollution, it wouldn't have lasted for so long. Hence, it is most probably because of post-viral infection. Children will most likely be suffering from upper respiratory tract infection, but asthma and croup should be considered. Upper respiratory tract infection, cough can linger for more than 3 weeks and is termed post-viral cough. However, coughs lasting longer than 3 weeks should be viewed with caution.
Oh, I see. It could be a post-viral infection. This happens a lot in children. What medication did he take last time for the infection?
The doctor gave him some azithromycin and it worked.
That's good, but if your son ever gets a viral infection, it is not recommended to take antibiotics because it is not very effective against viral infections. Have you tried any medication to relieve his cough this time?
I have not given him anything yet.
How often does he cough?
He coughs throughout the day, but it is more frequent at night. That's why he can't sleep well.
Besides the recent infection, does Adrian have any other medical history?
I think the last time he had a fever was about 6 months ago. Other than that, he's actually quite healthy and he doesn't get sick easily.
Here, we are presented with 2 important points. First, being is that the cough is more frequent at night. For children, if the cough is more frequent at night, it could be an asthma. In this case, a referral should be made. But because it is only been 2 days, there's a higher chance for post-viral infection.
I see. Other than the azithromycin taken for the upper respiratory tract infection, what other medication from pharmacy has he taken before?
He does not have any medication history other than that.
Did he try any herbal products?
No, he didn't.
What about supplements or the multivitamin tablet that you usually purchase from me?
I only give him the vitamin C.
Does Adrian have any allergies?
Not any that I can think of at the moment.
So based on what you told me, Adrian has been coughing since 2 days ago, following a recent upper respiratory tract infection. He did not try anything for the cough this time, and the cough is affecting his quality of sleep. Am I correct?
Yes, you are, dear.
It seems like Adrian is having a dry cough resulting from post-viral infection. Is it okay if I recommend Adrian something that will cause him a little drowsiness?
Yes, that should be okay since he's having some difficulty to sleep at night.
Okay, so I will recommend this Sedilix syrup, 2.5 ml every 6 hours. You can stop giving him after he recovers.
Okay.
I will also recommend Adrian Vicks VapoRub to help ease his cough. You can ask him to inhale it or rub it on his chest whenever he feels irritation. Would you like to take both or just the cough syrup?
I think I'll take both of it for him.
And here is the patient information leaflet for this Sedilix.
Okay.
You can have a look with it.
Okay, thank you.
Sedilix Linctus contains the active ingredient dextromethorphan. It is actually a non-narcotic cough suppressant. Cough suppressants do their job by blocking the cough reflex. Normally, suppressants with the active ingredient dextromethorphan are used to treat dry cough. Besides that, strong-smelling vapors such as the Vicks VapoRub can ease cough. That is why the pharmacist recommend these two products.
Mrs. Tang, you can try to give him hot honey or lemon to help soothe his throat. And here is a face mask for him. Since it is getting hazy recently, try to stay indoor as much as possible.
DJ, will be okay?
Don't worry, Adrian, you'll be fine. However, if the symptom persists after 3 weeks, please bring him to see a doctor.
Okay, I will. Thank you so much, Daphne. I'll see you again.
You're welcome, Mr. Tang. I hope he gets well soon. Take care and have a nice day.
Cottage cream.